What is granulation tissue? Describe the phases of granulation tissue and formation. Granulation tissue is the granular, slightly pink appearing tissue. Granular and slightly pink appearing tissue seen on a wound surface during wound healing. Seen on a wound surface during wound healing. So, granulation tissue is the granular, slightly pink appearing tissue seen on a wound surface during healing. It corresponds histologically to the small new blood vessel formation. It corresponds histologically to the small new blood vessel formation. Phases in granulation tissue formation. The first phase of inflammation after a trauma, blood clots at the injury site, phase of inflammation after a trauma, blood clots at the injury site. Acute inflammatory response is seen within 24 hours with exudation of plasma, neutrophil, and monocyte. Acute inflammatory response is seen within 24 hours with exudation of plasma, neutrophil, and monocyte. The phases of clearance caused by proteolytic enzyme liberated from neutrophils, autolytic enzyme from dead tissue cell, phagocytic activity of macrophages. Phases of clearance caused by proteolytic enzyme liberated from neutrophil, autolytic enzyme from dead tissue cell, phagocytic activity of macrophages. Phases of ingrowth of granulation tissue consists of neovascularization or angiogenesis and fibrinogenesis. Consists of neovascularization or angiogenesis and fibrinogenesis. Angiogenesis, the formation of new blood vessels at the site of injury, proliferation of the endothelial cells from severed blood vessel margin, proliferation of endothelial cells from severed blood vessel margin. The cells are seen as a solid buds initially and develop lumen to carry blood. The cells are seen as solid buds initially and develop lumen to carry blood. These newly formed vessels are leaky, thus imparting edema to the granulation tissue. These newly formed vessels are leaky, thus imparting edema to the granulation tissue. It is influenced by the vascular endothelial growth factor. It is influenced by the vascular endothelial growth factor VEGF, platelet derived growth factor PDGF, platelet derived growth factor, transforming growth factor B TGFB, basic fibroblast growth factor BFGF. It is influenced by vascular endothelial growth factor, platelet derived growth factor, transforming growth factor B, basic fibroblast growth factor. Fibrogenesis. The blood vessels are present in amorphous ground substance or matrix. Myofibroblast, new fibroblast with few features of fibroblast and smooth muscle cells we call myofibroblast. New fibroblast with features of fibroblast and smooth muscle cells are called myofibroblast. Fibronectin molecule have receptors on myofibroblast and form bridges in between the collagen fiber. Fibronectin molecule have receptors on myofibroblast and form bridges in between the collagen fibers. So this is a granular formation, granulation tissue. Describe the phases of granulation, granular tissue formation.